Welcome to the deep dive. Today, we're tackling a subject that really, it touches every single one of us, the quality of nursing care in hospitals.
It's absolutely fundamental.
Exactly. And think of this as your shortcut to understanding a truly vital piece of the healthcare puzzle. We've really immersed ourselves in a lot of material.
Right range, yeah.
From global players like Joint Commission International, JCI, and India's own NABH, that's the National Accreditation Board for Hospitals and Healthcare Providers.
Right, and practical insights, too.
Yes, from Supreme Medic Consultancy. And we've got a worldwide view from ISQA, the International Society for Quality in Healthcare.
Plus articles and even a chat about improving hospital nursing standards.
So our mission today, to really pull out the essential stuff. Why improving nursing quality is, well, just non-negotiable. What it actually looks like day to day.
They can measure it, the challenges.
Right, the real world bumps in the road, and where things are heading. Innovation. Let's dive in.
Let's do it.
Yeah.
And what's really striking, I think, is that this isn't some, side issue. Nursing quality is core.
It's the heart of it.
It really is. Nurses are there at the bedside constantly. They're the ones who often spot those tiny changes first.
That early detection piece, it sounds small, but the impact.
Oh, it's huge.
Mm-hmm.
A small observation can genuinely prevent a massive complication down the line.
And it links directly to something we all worry about in hospitals, those hospital-acquired infections, HAIs.
Definitely.
Yeah.
The sources we looked at are really clear. Strong nursing quality improvement efforts, they drive those HAI numbers down significantly.
You think about the daily routines, hygiene, wound care. It's the nurses doing that constantly.
Exactly right. And it goes beyond just infections. Think about information flow.
Documentation, escalation.
Precisely. Timely, accurate records, clear communication when something's wrong. These are fundamental nursing roles.
Then when they're done well.
It creates this safety net. And stepping back, when you have standardized, evidence-based nursing care that's regularly, looked at and improved.
Audited, maybe?
Yes, audited. It doesn't just help one patient. It lists the standard for the whole hospital.
And it's not just the technical skills, is it? The material also talked a lot about communication.
Crucial.
Not just team communication, but nurse to patient. That interaction, that attention, it builds trust, right?
Absolutely foundational, especially when someone feels vulnerable. And the data backs this up.
Lower mortality, fewer readmissions.
There's a tangible link shown in the sources between hospitals focused on nursing QI and those better outcomes. Makes sense, doesn't it? Consistent, evidence-based care leads to better results.
Okay, so let's unpack this a bit more. When we say improving nursing quality, what specific areas are hospitals really zooming in on? What are the key domains?
Well, number one, right at the top, has to be patient safety.
Makes sense.
And that covers quite a bit. Things like fall prevention, stopping pressure injuries. That podcast example mentioned the 4Ps model.
Oh, yeah, pain, position, possessions for hourly rounding.
Exactly. Simple, but really effective. And then there's safe medication administration. Hugely complex. Huge potential for error if not managed carefully.
The 4Ps, it's so practical. You can instantly see how that would help. And alongside safety, you mentioned clinical effectiveness.
Right. Making sure the agreed upon protocols are actually followed consistently.
Like for catheters or preventing surgical site infections.
Yes, those kinds of things. Translating the best evidence into what happens every day.
Yeah.
Standardizing it reliably.
And this must involve keeping a really close eye on vital signs, spotting the red flags.
Absolutely. Recognizing when a patient's starting to decline, even subtly, and having the skills to step in quickly. That early warning system is vital.
I can only imagine documentation is central to all this if it's not written down or not right.
It can all fall apart. Clear, timely, complete records, interventions, observations, outcomes. It's the bedrock.
Even small errors in electronic records could cause big problems.
Big downstream effects on communication, decisions, patient safety. Accuracy is key.
Communication just keeps coming up, doesn't it? The sources mentioned structured handovers, like SBAR.
Yeah. Situation, background, assessment, recommendation. It's a great tool to stop critical info getting lost between shifts.
So important during transitions.
That, plus good teamwork between nurses and doctors, therapists, everyone, high-quality handovers, maybe even bedside reporting involving the patient.
Bringing the patient into it.
Yeah, it all builds a more cohesive, patient-centered approach.
And patient-centeredness itself was a specific domain, right? It's more than just the medical side.
Much more. Involving patients and choices, respecting their cultural needs, their emotional state, empathy, dignity, That's quality care too.
It has to be.
And look, we also need to talk about the nurses themselves, nurse satisfaction and retention.
Happy nurses give better care.
It sounds simple, but it's true. Supported, engaged nurses provide higher quality care. So tracking burnout, workload, improving work-life balance. It's not just HR stuff.
It directly impacts care quality, empathy levels even.
Exactly. So, okay, we get the why and the what. But how do hospitals actually know if they're improving? What are they measuring?
The KPIs, the metrics.
Right. There are these things called nursing-sensitive outcomes. These are patient results directly tied to nursing care quality.
Like what, specifically?
Things like fall rates usually per 1,000 patient days, hospital-acquired pressure ulcers, or APUs. Well, technically APIs now, injuries.
Right, pressure injuries.
Yes. And infection rates linked to devices, catheter-associated UTIs, that's CIUTI, and central line bloodstream infections, CLAB-SI.
And medication errors.
Critical nursing-sensitive outcome, definitely.
Would seem very direct. What else?
Patient satisfaction scores are huge. Surveys like HCAKS in the U.S. or NABH surveys here in India. Direct feedback from the patient experience.
Makes sense. You have to ask the customer.
And sometimes it's the seemingly small things, how quickly nurses answer call bells, that really affects how secure a patient feels.
Yeah, I can see that. And then there are measures about the process itself, like documentation timeliness, following protocols.
Exactly. Are vital signs documented promptly? Are concerns escalated? Are safety checklists, like for surgery or high-risk meds, actually being used every time?
Compliance rates.
Right. And it's not just patient stuff. How many training hours are nurses getting? Are they completing competencies, participating in QI projects?
Even hand hygiene compliance.
Oh, absolutely fundamental. A basic but crucial metric for infection prevention. Plus, tracking how well early deterioration is spotted and acted upon.
It really paints a picture. Okay, so we have the theory, the metrics, but what does this look like in a real hospital? Give us some examples of these QI initiatives.
Okay, yeah, the sources had some great ones. That podcast mentioned hourly rounding, again, using the 4 Ps. They reported a 30% drop in falls.
30% just from being proactive like that.
Yeah, consistent proactive checks. And then there were 0 API campaigns for pressure injuries.
How did those work?
It was multifaceted. Regular skin checks, repositioning audits, making sure patients were moved often enough, plus targeted nurse training. One place saw a 60% reduction in 6 months.
Wow, 60%. That's massive.
It really is. And empowering nurses to, say, activate sepsis protocols faster.
Getting those antibiotics in quicker.
Exactly. Directly linked to better survival rates. Another good one. Post-discharge follow-up calls from nurses.
To prevent readmissions.
Yeah, especially for high-risk groups. They saw readmissions drop by up to 15% in some cases.
It shows that sometimes relatively simple ideas, done consistently, have big effects. Bed alarms were mentioned too.
Simple, but effective for falls. And just relentless focus on hand hygiene audits, proper glove use, things like that. Basic, but vital.
And technology's playing a part. Barcodes standing for meds.
Huge for preventing errors, especially with those look-alike, sound-alike drugs, LEA meds.
Right.
Plus, using standardized early warning scores, clear rules for escalation when vitals change, and training nurses on the teach-back method.
Making sure patients actually understand instructions.
Yes. Confirming understanding, not just delivering info. Routine pain scoring, too, and checking again after giving pain relief. Using SBR for shift handovers, nurse-led quality huddles, incident reporting systems. It's a whole toolkit.
Okay, so there are lots of tools and initiatives, but how do hospitals actually implement these changes systematically? What are the methods?
Well, a really common one, almost foundational, is the PDSA cycle, Plan, Do, Study, Act.
Right, the iterative approach.
Exactly. Plan a change, try it small scale, study what happens, then act, adopt, adapt, or ditch it. And repeat. Continuous refinement.
Makes perfect sense. Very practical. What about the more formal methodologies like Six Sigma or Lean?
Yeah, they're definitely used too. Six Sigma is very data-driven, focused on reducing variation, making processes reliable.
And Lean is about efficiency.
Right. Finding and eliminating waste in the system, making things flow better. And then there's shared governance.
Empowering nurses in decision-making.
Exactly. Giving them a real voice, ownership. That's key for making QI part of the culture, not just a top-down thing.
And ongoing training has to be vital.
Absolutely. Regular in-service training keeps everyone up to date. promoting evidence-based practice, actually using the research.
And things like quality champions, nurses leading initiative.
Yeah, training specific nurses to lead QI on their units, having regular reviews like nurse-led M&M rounds morbidity and improvement to learn from cases, root cause analysis sessions when things go wrong.
Visual reminders, too. Bulletin boards, dashboards.
Yes, making quality visible, maybe even annual QI showcase days. And using specific nursing tools like PEWS for kids, Braden scale for skin, Morse for falls.
It all sounds really thorough, but I bet it's not always easy. What are the challenges hospitals run into?
Oh, definitely challenges. Staff shortages are a huge one. It leads to burnout, feeling rushed.
Hard to focus on QI when you're just trying to keep up.
Exactly. And documentation overload. Nurses feel like they spend more time on paperwork than with patients. That's a common complaint.
And just resistance to change. People get set in their ways.
That can be a factor, sure. Human nature. Plus, inconsistent training. Maybe smaller or rural places don't have the same resources.
Data collection fatigue. Feeling like you're just ticking boxes.
That too. If staff don't see how the data leads to real improvement, they can disengage. The key takeaway, really, is that QI has to be baked into the culture.
Heard you that.
Genuine engagement, sharing the data openly, celebrating the wins, big or small, making it feel like everyone's effort matters.
Looking ahead then, what's next? Technology seems like it's going to change things even more.
For sure. We're already seeing things like AI-powered dashboards.
What do they do?
Analyze patient data in real time to flag risks, maybe predict problems before they happen, allows nurses to be more proactive.
Wow, and digital tools for handovers.
Yeah, making them smoother, safer, more sophisticated simulation training too, practicing skills and QI processes in a safe space.
That sounds incredibly useful for training.
Definitely. And maybe more patient feedback through apps co-designed with nurses so the feedback is actually useful. Mobile tools for reporting QI issues right from the bedside.
Making it easier to flag things.
Yeah. And maybe further out, things like voice assistants helping with charting, reducing that documentation burden, maybe even helping with alert fatigue.
And wearables. Tracking nurse fatigue or movement.
It's possible. Using tech to optimize the work environment, improve efficiency, reduce strain. Lots of potential there.
It is exciting. Okay, let's zoom out again. What about the big picture? The accrediting bodies, the organizations, what's their role in all this?
Oh, they're critical. JCI, Joint Commission International, is a huge global leader. Their accreditation isn't just a badge. It's based on tough international standards, focusing on continuous improvement.
They set the bar high.
They really do. Their mission is about enabling the highest standards, and they work in, over 70 countries? They have events like Unify 2025 coming up, tackling global healthcare challenges, big influence.
And in India, we have NBH.
Exactly, part of the Quality Council of India. They focus specifically on accreditation and benchmarks for Indian hospitals and healthcare providers, tailored to the local context.
And ISQA.
The International Society for Quality in Healthcare. They're more about connecting people globally, education, sharing knowledge, promoting external evaluation. Their conference in Sao Paulo in 2025 is focused on inclusive health systems. They bring together people from all over.
And consultancies like Supremedic, where do they fit?
They provide that practical support, helping hospitals navigate accreditation like NABH or implement specific QI strategies, offering expertise.
It really shows this whole ecosystem working towards better quality. And inside the hospital, nursing leadership must be just pivotal.
Absolute pivotal. Nurses are on the front lines. They know where the problems are and often have the best ideas for solutions.
So you need buy-in from the top. Nursing directors, CNOs.
Essential. They set the direction, provide resources, build that culture where QI is valued. But it's not just the top leaders.
Empowering nurses at all levels, ward leaders.
Yes. Giving them the authority and support to drive change in their own areas. Having dedicated nursing quality committees is important too.
A formal channel for ideas.
Right. And linking QI work to performance reviews, recognition that motivates people, mentoring nurse innovators, encouraging projects that involve multiple disciplines.
Speaking of disciplines, the sources mention specific focus areas for nursing QI depending on the unit.
Yeah, definitely. Like in the ICU, it might be super focused on protocol compliance, managing sedation carefully, strict infection control bundles, very high stakes environment.
Makes sense. What about the emergency department?
Their priorities are often about speed and accuracy under pressure, triage times, documentation, safety during overcrowding.
And for kids or babies.
Pediatrics and neonatal units focus on things like developmental care, absolute precision with medication doses, really involving families in rounds.
Home health, mental health.
Home health is about continuity, teaching patients self-care, good remote documentation. Mental health involves de-escalation skills, patient rights, specific suicide risk protocols. Each area has unique needs.
It really highlights how nuanced QI has to be. And the final piece seems to be collaboration, right? Nurses can't do this alone.
No way. It absolutely requires teamwork. Nursing needs to work closely with doctors, with HR and training, the quality department, infection control, IT. Everyone has to be pulling in the same direction.
Well, this has been a really fascinating deep dive. Pulling it all together, it's just crystal clear that improving nursing quality isn't just a nice to have.
It's fundamental for patient safety, for the quality of care across the board.
And continuous improvement isn't a project with an end date, is it?
No, it's an ongoing journey, always refining, always innovating. It's essential for better patient outcomes, safer care, efficiency, and importantly for nurse satisfaction and well-being too.
And it leaves us with a thought, doesn't it? As technology keeps accelerating, how can we really use it best to empower nurses even more as quality drivers?
That's the big question. And also, what role can every single nurse play right now in their own practice to build that culture of continuous improvement?
Definitely something for you, our listeners, to think about. And if you want to dig deeper, do check out the resources from JCI, NABH, and ISQA.
Lots of valuable information there.
Thank you for joining us for this deep dive. Until next time, keep learning and keep questioning.